Most people think normal test results mean you're healthy, but for millions of women, a normal test is actually the start of a decade-long wait for a diagnosis. Your symptoms are valid even when they're currently invisible to a standard lab. Today we are looking at the data on why 65% of women are initially misdiagnosed. We're going to explore the software glitch behind chronic pain and why your normal iron levels might actually be the reason you're losing hair, and the complex truth about health anxiety that most doctors get wrong. I know you're exhausted. I know you've been told it's just stress. Don't worry, this isn't another video telling you to just relax. This is a masterclass in clinical data and self-advocacy designed to give you the language to say, my tests are normal, but my life isn't. What are we missing? This isn't a rare story, it's a pattern. I want to tell you about Sarah. Sarah was 28, and for 3 weeks every month, she was a ghost of herself. Pelvic pain that felt like hot, searing glass, and a fatigue that made a flight of stairs feel like a mountain. She saw 4 different healthcare providers. She had 3 ultrasounds. Every single one was normal. One doctor suggested she try mindfulness for her heavy periods. By the time Sarah found a specialist who understood that standard ultrasounds miss a huge percentage of endometriosis, she had been struggling for 7 years. Sarah didn't have imaginary pain. She had a physical reality that the standard medical map wasn't designed to see. Sarah's story isn't an outlier, it's the data. Research shows that women can often wait 4 to 11 years for certain diagnoses. Why? Because symptoms in women are often attributed to psychological causes far more than in men. This is called diagnostic overshadowing. Normal doesn't mean nothing. It means the test wasn't the right tool for the job. Subscribe to my channel and join the women's health revolution, because the more we understand the science of our own bodies, the harder it becomes for the system to dismiss us. Let's dive into the common reasons why your blood tests are normal but you feel anything but. Pillar 1, the invisible hardware. Endometriosis and structural invisibility. Let's look at the first reason you feel unwell despite perfect tests. It's about invisible structure. Endometriosis affects 1 in 10 women, but the clinical reality from the data is that 20% of women with normal ultrasound scans still have endometriosis. Think about that. 1 in 5 women with this condition will walk out of an imaging centre being told that their hardware is fine, when in reality inflammatory tissue is growing where it shouldn't. Standard ultrasound scans miss many cases because endometriosis can be thin, flat or hidden. If you have chronic pelvic pain, a normal ultrasound scan is not a clean bill of health. It is simply one test that didn't find the answer yet. And this pattern doesn't stop with imaging. For example, we have functional hypothalamic amenorrhea, a topic I cover in another video. There's no blood test for this. It's a diagnosis of exclusion. This means your doctor has to rule out everything else first. And for those under 40 experiencing hot flashes or sudden anxiety, we need to talk about primary ovarian insufficiency. This requires specific hormone testing done twice, at least 1 month apart. If a doctor draws blood once and says you're fine, they haven't followed the protocol. You have to understand, most tests can't test for everything. They're primarily used to rule out emergencies. Some conditions can only be figured out once other doors have been closed. So what this means is, if your tests are normal, we've ruled out the obvious, and now the real investigation begins. Now let's talk about hardware versus software. What if nothing is broken, but something is misfiring? What if the structure of your body is fine? This brings us to functional disorders like IBS, fibromyalgia, and chronic fatigue syndrome. Think of your body like a computer with perfect hardware, but the software is glitching. If you open a laptop and look at the circuit board, it looks perfect. That's your normal MRI scan. But when you turn it on, the programs won't run. This can be where people are wrongly told it's all in their head. But that's not true. the software, your nervous system, is having trouble processing signals. Your brain is receiving pain or fatigue signals even when the organs look fine. This is a legitimate biological state of dysregulation. It's not in your head, it's in your wiring, but there are often no tests for this. The pain is just as real as the broken bone. It's just that the error is in the processing, not the structure. And most tests look for structural problems. You don't need a cast. You need strategies to calm the nervous system and retrain those signaling pathways. But you cannot start that work until you stop searching for a broken bone that isn't there. And now we need to think about something else: normal versus optimal. Normal on paper can still mean empty in real life. Let's talk about the ferritin gap, the difference between normal and optimal. The medical normal ranges are a wide bell curve. Take ferritin, which is about your iron stores. The range goes from 13 to much higher. So if your result is 14, your doctor sees normal. But the data shows that for optimal hair health and energy, your ferritin needs to be closer to 70. Now, this is something I always try to tell my patients. If you're at 14, you're technically normal, but your body's probably still running on empty. That's why when you've been told your blood results are normal, you can ask for the actual numbers. Don't just settle for the word normal. Ask, what was my score? Is this score optimal for my symptoms or just within the lab average? Now we need to talk about the hypersensitive alarm. This is the part where women are most often silenced. Health anxiety and hypervigilance are real biological conditions. In some cases, there isn't a hidden physical disease at all. Instead, the condition is how your brain is processing signals. Health anxiety affects up to 13% of adults. Naming this doesn't invalidate anything you're feeling. Imagine a security alarm. In a healthy state, it only rings if someone breaks a window. In hypervigilance, it rings because a leaf blew past the door. Most women with health anxiety do have insight. They know that they're anxious. That insight doesn't make the physical sensation less real, though. Having health anxiety doesn't mean you cannot also have a physical illness. That's why investigation must still come first, always. Let's discuss some sentences you can use to change how you're treated and which help protect your body and your voice. Because of the systemic biases we've discussed, you can't just be a passive patient. Use these questions to help support you. Number 1, the family member question. Doctor, if I were your daughter, would you be comfortable stopping the investigation here? Number 2, the impact statement. This fatigue prevents me from doing my job. This helps because doctors respond to loss of function, not just abstract symptoms. Number 3, the rule out clarification. What did this test rule out and what did it miss? Could this still be endometriosis, for example? Number 4, document the denial. Please document in my record that I requested this ferritin test and it was declined. Number 5, address your anxiety directly. Doctor, I know I struggle with health anxiety and hypervigilance, but that doesn't change the fact that I'm feeling this. I need us to rule out physical causes before we can attribute this solely to my anxiety. Nothing you felt was random. None of it was imagined. Your body is giving you signals and you deserve to be heard. Normal blood tests don't mean that everything is normal. And whether your struggle is hardware like invisible tissue and endometriosis, or software like a nervous system in overdrive like in fibromyalgia, or a sensitized alarm system such as health anxiety, your pain is real. You deserve care that takes you seriously. Remember this, the body communicates through symptoms, never through blame. Let's recap.